diet is actually really important, and the most important thing about diet is sugars. Is the brain does not like refined sugars. So particularly if you do have Alzheimer's, it is actually really good to try as best as possible to limit the amount of sort of like artificial or refined sugars. Exercise, it has been demonstrated in some big studies that were sort of like done as proper controlled trials, that if you exercise, you do sort of like really good cardiovascular exercise for 40 minutes 3 times a week, then that not only can reduce your risk of Alzheimer's, but it has actually been shown to downregulate some of the genotyping or genotypic propensities to Alzheimer's. So exercise is incredibly important. Limiting alcohol is sort of pretty obvious. You know, like if you're losing brain cells, you don't want to sort of like lose even more. But also if you do have cognitive impairment, actually pretty much due to anything, but in the context of Alzheimer's, and you drink alcohol, then you're sort of going to, you're already on a tipping point and you're just anesthetizing even more brain cells. So you will have an enhanced sort of effect, if you like, to the alcohol. Smoking similarly, and it's just not exercising your brain, it's exercising your body, it's exercising your brain as well. So I think we talked about this at the beginning, but as I said, it's not really just doing brain training exercises, it's learning a new language, it's learning new instruments, it's socializing, it's reading, you know, all sorts of things like that. Sleep, which we talked about, and then actually reducing stress. I mean, stress is bad for us, but a little bit of stress is good actually, but too much stress is bad for us. But it's also, when we are stressed and anxious, then it makes our cognition worse.